Wednesday with Mansfield today, and we are talking matters medical. Last week we were talking about the treatment of AIDS, and we had a whole slew of questions come in on info@Mansfield about pre-exposure pills or prophylactics. Tell us about them, Dr. Vicky. Sorry, Dr. Vicky.
Oh, hello.
Tell us about them, Doctor.
Okay, so we've now spoken about how effective the treatment is of HIV itself. Currently, there's about 38 million people living with HIV, and only 67% of them are actually on antiretroviral treatment, of which only 59% is virally suppressed. So it means it's really out there. So we need to have more means to try and prevent this transmission of HIV. So this is where the power of that PrEP comes in. The PrEP stands for pre-exposure prophylaxis. So you're going to prevent it. So usually it's a daily dose of a tablet. It's usually 2 drugs in one. This is where the problem comes in, to tell people you're not sick, but you have to take a daily tablet. So there's a bit of a barrier to the adherence and persistence to taking this daily pill, and this can lead to pauses and discontinuation along the PrEP journey. But study shows us that particularly young people between the ages of 15 and 24, and they're the most sexually active people, I would think, you know, they're the most difficult to actually convince to take this daily. Anyway, so that's the one problem. The challenge is to stay motivated. So the benefits of the HIV prophylaxis is basically sort of invisible. You know, it's not like you're sick.
You're sick and you're getting better. Your cough's getting better.
Yeah. So that's sometimes not affordable, okay, and sometimes not available. So these are all the problems. So it would be nice, and it's in the pipeline, that you get the longer acting PrEP formulas like injections. We'll chat about that just now, maybe injectables and pills that actually longer acting. You don't have to take it every day. So that's one way of overcoming this problem. And then there was an interesting question as well that I saw people asking, can you take PrEP on demand? So there's a study that was done. It depends on the route of exposure. So if you have vaginal sex, apparently, then it's very important to take the PrEP daily. If, however, you have anal sex, then four doses a week could be enough. So that's quite interesting, hey? Don't ask me why.
I was going to say why.
So the females must be very vigilant. But it's interesting. I don't know why.
Okay.
Yeah.
Are there any side effects to this PrEP?
Yes, there could be, but it's important to know that it's not very common, and it's also usually just in the first few weeks when you start the sort of treatment. So patients or people must try and remember that it is sort of transient. It should pass. Nausea is possible, and then what we say is try and take the tablet during the meal, while you're having your meal. Headaches could be possible as well. Just make sure it's not something silly like dehydration or lack of sleep that's causing your headache. But you can just take paracetamol, and as I say, it should pass. Diarrhea is not that common. It's actually uncommon, but it can also help if you take the pill with the meal. You play around with the dose a bit and see what works for you. Then it's important to keep an eye on your liver health, because these tablets can affect the liver, especially if you've got a liver problem. So if you start taking those tablets and you start getting yellow eyes or very dark urine or very light stool or loss of appetite, then maybe time to just visit the GP and to check your liver functions out. Also the same with the kidney. Kidney health is important. So they'll probably do blood tests to check your kidney function before you start. And it's important, these people that take gym supplements like creatine, it can it can make your kidney function look abnormal when it isn't. So it's important to tell your doctor that you are actually on those kind of gym supplements, so they don't freak out and say, well, you can't take PrEP. See.
Okay.
The loss of bone is also possible. So if you've got known osteoporosis, then maybe just be careful. Keep an eye on those things.
Are there any other PrEP options at the moment? I mean, this research is continual.
Yeah.
Is there anything new in the pipeline that you're aware of?
There's quite a few things. So at the moment that's available is the dapivirine ring. So it's actually a vaginal ring with medication in. It's available in 5 African countries, including South Africa. And it's said to reduce the risk of transmission by about 50%. So the World Health Organization suggests this vaginal ring in places that sort of low and middle income countries, or when the PrEP's not available. Mm-hmm. So that's the one thing. And then there are two injectables also. They're busy doing studies. In fact, the longest acting one, I think in South Africa, they're going to start studies now, soon. The one is an 8-week injection, and the other one is actually a 6-month injection.
Jeepers.
Which will be so cool. Yeah. That will be really good. There's broad neutralizing antibodies also in the pipeline, whatever that means. And then there's a monthly pill, which is extra potent. It's got a long half-life. It also comes in the form of an implant. That's on phase 3 of clinical trials already, so that's quite far, ahead already. So those are the things in the pipeline. And then we must also remember that the vaccine for HIV, it's a continual, they're working on that. So that's what's available.
Okay. Thank you, Doctor.
Pleasure, Jeremy.
For your time.
Pleasure.
And we'll catch you again next week.
Yes.
And we'll catch you tomorrow with the Travel Show. Until then, bye-bye.